Good morning, everyone. Mayor Lisa Brown. Today I'm going to be announcing some new directives related to public health and public safety in Spokane and focused on the Division Street corridor. And yes, comes the door down. Good morning. Today I'm going to be announcing some new directives related to public health and public safety in Spokane, particularly focused on the Division Street corridor and the intersection of 2nd and Division. Before I detail those, I want to acknowledge those who are here with me today: U.S. Attorney Vanessa Waldruff, Consistent Care, Spokane Treatment and Recovery Services, also known as STARS, Fire Chief Oberg, Police Chief Lundgren, Code Enforcement Director Luis Garcia, the Empire Health Foundation, the U.S. Drug Enforcement Administration, the Washington State Patrol, Council President Wilkerson, Councilmember Lily Navarrete. We're here today because our community is dealing with the devastating impacts of fentanyl and other opioids. You heard the sirens leave just now, and the chief informed me that, in fact, they were going on an overdose call to Brown's Addition. Everyone knows someone whose life has been lost or dramatically altered because of this crisis. I know I do. It's taking the lives of our loved ones and neighbors. It's impacting our businesses and livelihoods. And today we're taking action. I am declaring an emergency in response to the opioid crisis in the city of Spokane. We know that the area around 2nd and Division is a hot spot. We know that many people experiencing homelessness are battling substance use disorder there. We know that this population is often preyed upon by people who are dealing these drugs. And we acknowledge that residents, business owners, and property owners in the area are dealing with the secondary impacts: litter, graffiti, and other problems. Today's emergency declaration streamlines our ability to take several actions related to combating the opioid crisis and addressing the needs of the unhoused community. First, by declaring an emergency, we're able to move funding and issue contracts quickly. Our state partners are taking the next step in the right-of-way encampment resolution program process in partnership with the Empire Health Foundation. Over the past few weeks, we have contractors in the corridor engaging with the unhoused population. We know that there are people willing to engage in the process and be connected to services. In order to do so, we're entering into a contract with the Empire Health Foundation to operate our Cannon Street facility as a temporary transition center. People who enter into the temporary transition center will be connected to proper services, treatment, and ultimately housing solutions. We are also able, because of this order, to immediately partner with Consistent Care for our High Utilizer initiative. High utilizers are a specific population of people who cycle between the street, emergency rooms, and jail. Using the already approved allocation of opioid settlement funds, Consistent Care will immediately begin to identify that population and work with them to break the cycle of addiction and trauma. Second, in tandem with the emergency order, the city is bringing together a variety of our own resources and partnerships with nonprofit service providers, emergency responders, and law enforcement. Spokane Treatment and Recovery Services, STARS, will utilize their CAR 50 program. This program provides safe, compassionate transport for individuals under the influence of a substance to an appropriate medical or treatment facility. In addition to responding to police and fire calls for transport, CAR 50 also proactively drives through the city to stop and offer rides when appropriate. This is a well-known and respected program, which is why CAR 50 is often flagged down for help during their proactive routes. and I am pleased that STARS has agreed to narrow, for the time being, their citywide focus to the Division Corridor. This means they will be in the area 6 times every 24 hours, in addition to any calls for assistance from other first responders. This is a fantastic program. 80% of STARS staff are people with lived experience. Spokane's Fire Department Medical Director is issuing a standing medical order for the fire department to provide proven medical intervention for withdrawal management. This means that SFD now have another tool to support individuals into treatment following a non-fatal overdose or a related emergency call. We know this is a hot spot for drug dealing, and we intend to disrupt the drug market with law enforcement. We are working with local, state, and federal partners for resources. Spokane Police will be adding additional patrols in the corridor and adjacent areas. We want to make sure those who are preying on our most vulnerable population are being held accountable, and those who are dealing with substance use disorder have access to services. There is also an element of enforcement within the right-of-way encampment resolution program. People who are in the area that refuse to go into services and are participating in illegal activity will be held responsible. The third part of this is that we are going to be requesting additional help from the state, including we are asking for additional doses of Narcan and fentanyl test strips to supplement the existing supply for our first responders, and we are initiating a request for providers to give us ideas about best practices for utilizing additional opioid abatement settlement dollars to meet the needs and strategies outlined in the settlement between Washington State and the opioid manufacturers. With that, I'm turning things over right now to U.S. Attorney Vanessa Waldroff for a few comments. And following a few speakers, I will sign the executive order.
Good morning, and thank you, Mayor Brown. I'm grateful for the opportunity to be here with our priority partner, DEA, and our powerful community and law enforcement stakeholders on behalf of the U.S. Attorney's Office. I was born and raised here in Spokane, and my husband and I now proudly raise our 2 children here. I deeply care for everyone's safety here in Eastern Washington. Our Spokane community is facing an extraordinary challenge with the growing and continued influx of deadly fentanyl and other drugs into our community. The downtown area has been hit particularly hard. The fentanyl crisis, in particular, is the new face of the opioid epidemic, and the death and tragedy that we are witnessing is staggering. As the United States Attorney, my mission is to build a safer and stronger Eastern Washington community. And that starts right here with building critical partnerships to have both law enforcement strategies with our key partners at the Spokane Police Department and Spokane County Sheriff's Office, as well as proactive engagement to empower our community and protect our loved ones. My job as the Chief Law Enforcement Officer is to set strategic enforcement priorities to identify and prosecute the most significant drivers of violent crime. Drug trafficking and violent crime are closely linked. My team works closely with DEA and all our law enforcement partners, and we have seized hundreds of thousands of poison fentanyl pills and other drugs, keeping these dangerous substances out of the hands of drug traffickers and out of our community. We are prioritizing the prosecution of fentanyl cases, vigorously seeking to disrupt the sources and supplies of drugs in our communities, and to send a strong deterrent message to criminal drug networks. I'd like to highlight 2 cases that I think are particularly important for today. One was a focus case that happened just a few blocks away from where we are standing here today. In United States versus Alexander Kosnicki, we had a repeat offender who was distributing these drugs just blocks away at a Catholic Charities location. Mr. Kosnicki, who was convicted at trial and is awaiting sentencing, was trespassing at an apartment complex when he was contacted by law enforcement. After he was arrested, law enforcement located a stolen gun and large amounts of fentanyl inside his sock, along with a substantial amount of U.S. currency from drug trafficking. This case came together and was able to be prosecuted in federal court because of the incredible partnership between state, local, and federal law enforcement agencies, including the ATF, DEA, the Spokane Police Department. A large-scale case that I also want to highlight was an operation that we recently had a large takedown, and it involved nearly 40 criminal indictments brought throughout eastern Washington, including right here in Spokane. It also involved a large network of organized crime in the Yakima Valley, Walla Walla, and elsewhere. That case, which involved tremendous collaboration between the Drug Enforcement Administration, Homeland Security Investigations, the Bureau of Prisons, the U.S. Marshals Service, the Bureau of Indian Affairs, the Yakima Police Department, and the Yakima County Sheriff's Office. I could go on and on. We had so many wonderful partners there. But that shows the incredible commitment we have to collaboration and how this really requires an all-hands-on-deck approach. We're going to focus on the largest drivers of violent crime and drug trafficking in our communities, and we're also going to focus on the cases that we know right here in our community really matter for community safety. We will continue this effort, and every day, my team is seeking justice in these critical cases. But we have to do more, like we're doing here today, to stop these poison pills in our community. Federal prosecutors are working closely with our tribal, federal, state, and local partners to identify and prosecute the drug traffickers who seek to profit from the sale of these deadly substances in our communities. We target the command and control elements of the cartels, the money launderers, and the violent and heartless individuals who choose to sell this poison. Through our law enforcement efforts, we are seeking to hold these criminals responsible for the damage that they have caused to our communities. On the prevention front, we have partnered with DEA, which works closely with our law enforcement partners, local governments, and community outreach organizations, such as the Spokane Alliance for Fentanyl Education and the Race Rudine Foundation, who are engaged in our communities, our schools, really focusing on how we can have engaged community prevention efforts for everyone that can be successful, and we can see the results in having lower addiction and dangerous impacts of the substance abuse disorder in our community. I call this an all-hands-on-deck strategy by state, local, and federal law enforcement: prosecution, prevention, and treatment. The impact and overall effectiveness of this initiative is directly dependent on the entire community, our law enforcement, healthcare, prevention, and social service professionals working together to mitigate the fentanyl drug threat. I am committed to prosecuting the criminal drug cartels who put our communities and our youth at risk. Our office has been prosecuting fentanyl cases since 1920, even longer, but 2016 is when fentanyl really came into our communities. And we will continue to vigorously prosecute these cases as part of our ongoing efforts to build safer and stronger communities right here in the Eastern District of Washington and here in our downtown Spokane community. Thank you, and I'm going to turn the time over to Dr. Nevin.
Good morning. Consistent Care is grateful for the opportunity to serve Spokane's most vulnerable residents with case management to guide them into treatment for substance use disorder, mental illness, and medical conditions. Consistent Care has been case managing vulnerable patients for over 10 years by reaching out to them in the community where they're located, building relationships based on trust, and then transporting them to services. At Consistent Care, we believe in human potential. We know that evidence-based care for opioid use disorder and mental illness is effective, and everyone deserves the opportunity for recovery. We know that most patients with substance use disorder want recovery and treatment, but they find it difficult to start this process, and it's easier to continue using. Existing treatment systems are difficult to navigate, especially when a person's impaired with mental illness or substance use disorder. We use a case management team composed of a nurse case manager and a community health worker, along with deep connections within the community to navigate these patients into stabilizing treatment when they're ready. Lives are transformed when people are navigated into proven treatments for opioid use disorder and mental illness, and these treatments are available in Spokane. We welcome this opportunity to help Spokane's most vulnerable residents in collaboration with the City of Spokane and its public safety agencies. And now I'd like to introduce Ryan Kent from Spokane Treatment and Recovery Services.
Thank you, Mayor Brown, for giving Spokane Treatment and Recovery Services this opportunity to share a little bit about our programs and vision for the future in collaboration with this great community. STARS is fortunate enough to have been around to serve the community for the last 44 years. You may have known us as Community Detox Services of Spokane in the past. A lot's changed since 1980, and we offer quite a few more services than just detox these days. Something that I learned early on in my 11 years at STARS is the community is constantly changing, and STARS has always challenged itself to meet those needs and evolve to meet those needs in the community. We have many programs that provide a vast array of services, and we strive to promote innovative ways to meet those needs. Something STARS is consistently developing and evolving to help those struggling with substance use disorder and mental health is our unique diversion programs. These programs provide case management and resources for individuals that are still in the contemplative phase of recovery, which is one of the more difficult phases, as we all know. STARS believes it's vital to meet people where they're at and allow them the opportunity to be given choices and options upon first contact. Give them autonomy, treat them with dignity, empathy, and respect. We know that the first point of contact is crucial in how an individual perceives the way treatment will go. One of our diversion programs is our Emergency Services Patrol, known by quite a few names: Car 50, the Fire Dispatch, the Detox Van, the Red Van, right over here. We've been recently working with Chief Oberg to figure out new and innovative ways to continue to evolve this program and meet the needs of the community. ESP provides services to individuals experiencing acute intoxication or seeking behavioral health services. Our goal is to get them to proper services by initiating dialogue with the individual and determining the best option for them, along with their input, which is important. Sometimes it is through STAR services, other times it is transportation to a shelter or to a residence. We find that communicating with these individuals needing services in an empathetic and respectful way produces the best results and a better chance for success. Giving people choices instead of ultimatums is always best practice for STARS. With our community partnerships and years of developing resources, we can provide those choices. STAR's vision for the future of Car 50 involves additional emergency services training that Chief Oberg and I have discussed recently, as well as providing peer support to ride along with Car 50 for additional support, safety, and a lived experience point of view. Most of our drivers and our staff in general have lived experience, and having this background provides unique perspective when helping someone struggling with substance use or mental health. Providing basic needs and care like meals and water is something we desire to start doing again. The Red Van is known to the community, and many times it's flagged down by people who are familiar with the drivers and where it can take them. This is a need more than ever for these types of services, and it's important to collaborate with other services. Currently, we're working with other community providers to fill in the gaps or obstacles that are apparent when working with the population that we serve. STARS has a unique perspective in finding those gaps and obstacles because we work closely with first responders, have case managers in emergency rooms, specialize in behavioral health services. And we look at these encounters from a clinical perspective through lived experience and years of providing services in each of these environments. Because of our model, we see the trends as they're developing, being a first point of contact, and developing and adapting to those challenges is something that STARS strives to accomplish. All of our staff are trained as navigators in how to recognize barriers, gaps, obstacles, and how to find solutions to those. For someone who struggles to get basic needs, navigating the behavioral health system can be daunting. And it's our mission to take that stress out of the equation. STARS just opened a 38-bed withdrawal management facility at 628 South Cali. It's the service that the community was in need of, that we knew it was in need of, and rushed to get it open for this very reason. STARS believes it is important for our clients to play an active role in their treatment process, and we think it should start as early as possible, including that first encounter on the street with Emergency Services Patrol. We practice in every one of our programs through our continuum of care. Emergency Services Patrol, withdrawal management, our male and female co-occurring inpatient programs up through IOP. As Mayor Brown mentioned earlier, Emergency Services Patrol is focusing our attention on the division and second corridor by interacting with individuals and again, meeting them where they're at, and making sure that that first point of contact is a good one, and know that there's a safe environment for them to go to. STARS sees the stress on the first responders, the desperation on the faces of individuals struggling with substance use, mental health, and homelessness, the overworked providers. We know it's a team effort. It's a team effort with the community, and it's our mission to continue to play an active role. Thank you. Next up is Chief Julie Obert.
Thank you, Ryan. Spokane Fire Department, we truly appreciate our partnership and look forward to growing that partnership even more with the STARS van. So I'll keep my words short. Just want to, again, point out, as Mayor Brown did at the beginning of this, that just prior to the start of this news conference, units out of Station 1 responded to an overdose call where Narcan had been administered to a person. So we stand ready to be a part of that solution, both through the expansion of our CARES program, which helps provide wraparound services to those in need, as well as our behavioral response unit, which is our emergent arm that responds emergently with our crews, and their main goal is to try to divert away from emergency rooms and making sure that individuals are connected with the right resources. I want to point out some really compelling numbers. So throughout the county, between 2019 and 2023, overdoses have risen by a stunning 83%. Within the City of Spokane and Spokane Fire Department calls for service for overdoses, just year to date in 2024, they've risen by 30%. With the majority of those being right here in the downtown corridor. So as a Spokane Fire Department, we stand ready to be a part of that solution in all ways that we can. And now I'd like to bring Mayor Brown back up to the podium.
Thanks. As the speakers have made clear, this is a team effort, and partnerships are going to be part of the essential aspect of building capacity to really address the severity and the significance of the crisis. So with this, I'm going to sign this emergency declaration, and then we'll take a couple of questions. Thank you. A couple of questions we have time for? Yes. Well, we all know that the crisis has been growing, and the statistics clearly point that out. But the purpose of an emergency declaration is really to streamline and deploy resources quickly. And without that, the public processes can take weeks or even months. So with this declaration, we can sign contracts today. And that means people will be putting these services to work immediately. And I want to thank the City Council for passing the opioid dollars. We have more, and we will be deploying more over time. But this first tranche of funds that we're going to put to work immediately will help, I believe, help us start to make a difference that will be noticeable to the public over the next several weeks. A couple of things. One, we got data that we requested from Spokane Regional Health Department, and I want to thank them for being a partner and working with us. We're going to be establishing a dashboard that will be available for the public, but that data made it clear, and as the statistics the chief just mentioned, that this has risen to the level of an emergency, a crisis, but also it's important to have it's important not just to say there's an emergency, but to be able to do something. And these resources that are now available can be deployed. Some are coming from the state level through the Encampment Resolution Program, and we can get them to work immediately, and some are coming from the opioid settlement funds.
I was wondering if you had any more details about the Cannon shelter that you could share, like bed space, capacity, goals of that facility.
Yeah, so the Cannon facility will be a temporary transition center. So people who are prepared to enter into services can be transported there. We don't know exactly how many there will be at this point, but we are anticipating maybe 20 to 30 people at a time. And ideally, within a few weeks, they receive the assessments and the referral to the appropriate place for them to have at least transitional, if not permanent, housing. So it really provides that ability to serve as a place where partners can come together and provide services. For example, can the person be qualified for Medicaid and mental health services provided by Frontier Behavioral Health? We've reached out to several different partners to become part of that effort there. And Empire Health Foundation is the independent operator for us that will help coordinate the different providers in that location.
Does the city have enough available treatment resources to keep up these efforts, and what impact do we expect this will have on emergency rooms?
This, well, actually, the goal of these efforts is actually to reduce the utilization of emergency rooms. I just met with Providence yesterday, and we are also talking about how we can share data to show the effectiveness of doing these types of programs with high utilizers. This was a program that was existent in the past in this community. It was known as hotspotters at that point. And so in essence, we're bringing that back, and we believe that the impact of that, as well as the street medicine funds that the legislature has allocated to us that we'll be able to be putting out there soon, the proposal for the street medicine piece, we think those two things together will start to make an impact on emergency room utilization. And we want to free up resources in our healthcare systems for additional places for people to go that are appropriate places for them to get care.
I know
know you've talked a lot about your plans for different shelter models. This, going with that, do you think that's going to make effective change the next couple months?
Could you say that one more time?
The shelter models you've talked about.
Yes,
that's
thank you.
gonna-
There is a lot more going on, including the current request for proposals to move away from the large congregate shelters into smaller scattered site models. And so, yes, that is underway, and we think that that will be part of the process here. It will give us places for people to go. The vision of our team internally is that some of these small scattered site shelters may be particularly appropriate for certain populations. We may be able to make them appropriate for people with mobility issues, or people of a certain category staying together may be more effective for them. Thank you. Oh, one more here.
So what are we actually, I mean, what are we doing for the firefighters who are, getting burnt out every day, running their engines? They're running them constantly, responding to these calls, running the engines down, and then, taking away their resources for other things like fires. I mean, it seems like it's kind of running down the fire departments a little bit. So is there anything that we're specifically doing?
I think I'll let Chief Oberg take that one.
Absolutely. So we have a very robust peer support program that regardless of the call type, they can reach out, and that really is a best practice of talking to a peer. But to the point of your question, it is a significant commitment of resources that we make. Now, we are looking at all of the reliability for all of our calls. We're maintaining that. We have some programs coming in the near future, such as the nurse navigation line, that will also help reduce some of the stress on that. And that's part of what this entire program is going to do, is going to help reduce the stress of that. But I support all the members of our department, and we're going to respond regardless of the incident.
Thanks. That's it for tonight.
This is all, a bunch of this is the Star Guys notes, but